I am Dr. Supriya Sharma, and we have with us today Dr. Sheh Rawat,
Hello.
Senior Consultant Radiation Oncology at American Oncology, Gurugram. Sir has been awarded MD in Radiation Oncology from SMS Medical College, Jaipur, and has been awarded the UICC International Fellowship from Long Beach Memorial Medical Center, California, USA. The topic that Dr. Sheh Rawat has chosen today for discussion is CA rectum. Welcome, sir. Let's proceed with the session. To begin with, sir, can you please tell us what is rectum and what is the cancer of rectum?
Yes. So, in our digestive tract, when we eat anything, it goes to the digestive tract, into the stomach, and it passes through the intestines. As you can see over here, these are the intestine, and this is the last part of the intestine. This part is called rectum. So, whenever there is a growth in this part of the intestine, this is called rectal growth, and if on biopsy it is proven as cancer, then it is called CA rectum.
Yes, sir. CA rectum, you said, sir. What are the signs and symptoms of CA rectum?
Generally, a patient may have complaints of constipation, sometimes diarrhea, passage of very thin stream of stool, crampy abdominal pains. There may be passage of clots in the potty, in the stool. Patient may have loss of weight, tiredness, fatigue, and these are the signs and symptoms that a patient might have before the diagnosis of his disease.
So, are there any specific risk factors associated with CA rectum, or is there any specific population at risk?
Yes. So, if you talk of population at risk, generally the incidence is higher in African males or African people of American African males. Then as the age increases beyond 50, the incidence is also seen to be rising. There are other risk factors like decreased consumption of high fiber diet. If a patient is having low fiber diet, if he is having lot of consumption of meat, there is lack of exercise in his daily routine, obesity, then excessive smoking, excessive drinking alcohol, these are certain risk factors. If a patient is having diabetes, that also aggravates the risk. Then there are certain situations in which this cancer runs in families also. So these are certain risk factors which increase the chances of having rectal cancer.
So, sir, how do we diagnose cancer of rectum?
Usually, patient will come to the OPD or come to a doctor complaining that he is having fullness in the abdomen. He may say that I feel like I have not passed adequate stool after passing. There is fullness in the stomach. Sometimes patient is complaining of diarrhea, sometimes loose motions, pain abdomen. Patient may complain of weight loss. So whenever such complaints are there, then the doctor will perform a digital rectal examination or do some endoscopy. And if on endoscopy we can visualize some growth, then we usually take a small biopsy from there. Biopsy is the surest way of proving that it is a cancerous growth. Once it has been proved on a biopsy that it is cancer, then we do a battery of investigations like imaging. Imaging may be in form of CT scan or MRI scan, or more frequently being used nowadays is PET CT scan. So endoscopy, biopsy and imaging. These are the three main modalities by which we can establish a diagnosis of cancer.
So once it is diagnosed that it is cancer of rectum, the staging of this disease is similar to cancers in the other parts of the body?
Yes, so the imaging will determine the extent of the disease, whether it is still confined to the rectum or it has spread into the adjacent areas in the abdomen or distant parts of the body. So once we do the imaging, then we are able to confer a stage to the disease, whether it is in stage 1, 2, 3 or 4.
So as you shown us where rectum is exactly, we've seen some patients who've placed a colostomy bag around this area. So is that a part of treatment associated with this, or what exactly does a colostomy bag do?
As I told you, there is a growth in the intestine, in the rectal part of the intestine, which leads to obstruction in the passage of stool. So if the obstruction is severe, the stool may not pass freely through the rectum. It may start accumulating within the bowel loops in the abdomen, and eventually it can lead to perforation of the intestines. So sometimes when patient is complaining of total obstruction, total obstipation, no passage of stool at all, the abdomen is distending, bloating, patient is having severe crampy pain. In those cases, before starting the treatment, we may have to go for a procedure called diversion colostomy. In this, we place a bag outside the body which connects directly to the intestine. Until such time that the treatment of cancer is completed, that bag will be placed so as to facilitate passage of stool.
So what is the main treatment of CA rectum in combination or in after this placement of colostomy bag?
So, depending upon the stage in which the patient has been diagnosed, say for example, if it is very, very early stage 1, then in those cases, only surgery may suffice. But usually, cases are not diagnosed in so early a stage. So, most of the times the treatment is pre-operative chemoradiation, which means prior to surgery, we will do radiotherapy along with chemotherapy in various sequence and combinations. So this treatment continues for a period of about 2 to 3 or 4 months. After that, we give a little rest of 1 to 1.5 months, and then we subject the patient to surgery. So the treatment is combined modality treatment. It involves all the 3 modalities like radiation, chemotherapy and surgery. All the 3 modalities are required in most of the cases of CA rectum.
So sir, the side effects or the side effects mainly of CA rectum are also similar to as that of any other part of the body?
You mean side effects of treatment?
Side effects of treatment, sir.
Yes, definitely. Majorly the side effects will be pertaining to pre-operative part like chemotherapy and radiotherapy. Chemotherapy may be associated with very little incidence of vomiting, nausea, hair loss. These are all temporary changes. The hair loss is temporary. After completion of treatment, hairs start coming. Nausea is only there for a few days, and after that we have got very effective medication to control the nausea. Radiation may sometimes lead to burning sensation in the while passing urine or passing stool. These are all temporary changes, and if the benefit is large and side effects are this much, then we have to look at the larger benefit.
Are there ways to prevent this cancer?
Yes, the risk factors which we discussed, they are, if we take care of all those risk factors, they are the ways like maintaining a healthy lifestyle in form of avoiding excessive smoking, excessive drinking. We should exercise daily. At least 20 to 30 minutes we should dedicate to exercise in our daily routine. We should eat a diet which is rich in high fiber content. Say for example, fruits and vegetables. Avoid taking lot of meat. And sometimes there are some familial syndromes like Lynch syndrome or familial adenomatous polyposis, in which in the intestine some polyps are there. So if the patient is having these kind of familial diseases, they are at increased risk of developing rectal cancers. So when you consult a doctor, usually you should go for screening once you have crossed the age of 45. So doctor will talk to you, take your family history and other histories, do some physical checkups, and if he feels necessary, he will subject you to certain investigations like screening colonoscopy or something like that. So taking care of these risk factors are the ways to prevent development of not only rectal cancer but any cancer in the body.
So sir, does this mean that this disease runs in the family?
In a few situations, like if someone in the family is having Lynch syndrome or familial adenomatous polyposis, the children in those families are at a slightly higher risk of developing rectal cancer.
Okay, sir. So towards the end of the session, you have any message for our audience who's watching?
So the message is that if you are having symptoms like constipation, diarrhea, passage of blood or spotting in the fecal material, bloating of abdomen, crampy abdominal pains, fatigue, feeling of fatigue, tiredness, feeling of incomplete evacuation after passing stools, then you must consult a doctor, get some basic tests done as advised by the doctor. Treatment is very simple and very effective. It is a curable disease. So don't be afraid by coming to know that I have got a cancer. It is curable. Thank you.
Thank you so much, Dr. Sheh Rawat, for your time. And thank you all for watching. We'll meet again in the next session. Thank you.